Hi there, I'm Dee Collins, the editor and publisher of Focus magazine. We've got a great interview today with Dr Anuya Deshpande, who has the Cosmetic and Veins Clinic here in Tauranga. So Anuya, tell us a bit about yourself.
So I born in India, raised in the UK. My parents are still back in the UK. I graduated from medical school in the UK and moved to New Zealand in 2006, mainly just as a working OE. And just working as a general practitioner with an interest in some cosmetic medicine, and I've made Bay of Plenty our home for the last 2 years.
And I believe at 18 years old there was a chance that you might actually do something else.
I have always had an interest, a passion for art, and I thought I was quite good at it, and studied it properly till the age of 18, and I had to make a decision as to whether to study medicine or whether to take up art professionally. My mind took over the heart, so my mind said go medicine, and I think that was the right decision. I did lots of rotations as part of the training in the UK. I decided to go into general practice, and part of that was working in emergency medicine, working in obs and gynae. I did a stint in psychiatry and pediatrics. So that gave a really good foundation and grounding for general medicine. I loved ED work. I loved the fast pace, the challenges, and having to make quick decisions. But I found a good happy medium in general practice, but my heart was still calling out for the art side of things. And that's really when I found that balance of, okay, do I specialise in plastic surgery? That was going to be another 7 years postgrad training. I didn't feel that was a path that I wanted to pursue. And so I found cosmetic medicine. When we see things and we look at a face or a painting or the violin that's meant to be the most beautiful violin in the world, or the inside of a nautilus shell, there's a mathematical ratio as to why these things are actually beautiful. And this can be equated, that's called the golden ratios, or phi, PHI, and that ratio can be applied to faces. So when we look at models and we look at supermodels, so we look at Angelina Jolie or Brad Pitt, these famous celebrities photograph so well, they look so perfect, is because their features fit those golden ratios. In cosmetic medicine, that's what we study. So we study the science and the maths and the numbers behind what proportions look right to give you beauty. So there's definitely a science behind the beauty, and that's what we as cosmetic physicians do.
So if somebody came in and said, I need X, Y, Z done, and you look at their face and go, well, it's not actually that, it's this that you need to focus on. That's the sort of thing you'd be doing?
Yeah, absolutely. I think a good saying is you don't know what you don't know. Mm-hmm. And that's why, like recently, I go to a stylist to find out what clothes will fit me, the right shape and for my style of body. It's the same when you go to a professional. A feature that you might find is not fitting with your idea of beauty. So someone might come in and say, oh, I've got really thin lips and I need my lips doing. In actual fact, it might be needing lifting the cheeks or addressing the jawline. So I actually look at an overall picture. I don't focus on just one minor thing. And I liken it to, if you're building a house, you have to have a master plan. You don't just work on one room at a time. You have to look at the overall picture. I'm not an injector that just makes changes overnight. It's got to be gradual. And I think that is more acceptable both to the patient, and also I think cosmetic medicine is still not fully accepted in society. And that's something I'd like to change. Mm-hmm. We've been talking about letting your hairs grow grey naturally. Well, actually, I colour my hair to cover the greys, and there's always a little something. Going to the hairdresser is acceptable as reducing the signs of aging, and I think having a few injections or having a little bit of a lift or a nip and tuck here and there should become acceptable if a patient wants it. but it's a society's opinion of it.
And it's also what you're comfortable with and what you're wanting out. So tell us all the procedures you do on your face that you are able to do.
Yeah, so it can start with a simple skincare regime. The biggest thing I recommend to people is having a good cleansing, moisturising and skincare and sunblock regime. So in this country, you know, first and foremost, I'm still a doctor. It's our job to advise about protecting against skin cancers. So if I see pigmentation, redness or changes in the skin due to sun damage, we advise on that. So the reason we all wear foundation is to have a clear complexion. You can achieve that with good skincare. Then comes, if you've got lines or wrinkles or sagginess or asymmetry, then muscle relaxants with injections such as Botox or Dysport can be used. And used in the correct way and very subtly, you shouldn't be noticed for that change. So people should notice you, but not notice what you've had done.
Yeah, you're looking more restful.
Absolutely.
Not like, wow, how much work have you had done?
Absolutely. And I do pride myself in thinking my patients aren't the patients out there being noticed, but they actually have a level of confidence that the changes have made a difference. So going back to your question, yeah, there's fillers, there's thread lifts, we have a plasma pen, there's a lot of tools that we have in our toolbox.
And I believe there's a double chin.
There is.
Yeah.
So this has been out for a few years. It's a licensed medicine called Belkyra, which is about 2 treatments, about 8 to 10 weeks apart, injections which help dissolve the fat cells. And that's a permanent result. So once you burst those fat cells go. So beautiful result for that little bit of exercise resistant fat under the jaw.
You also concentrate on the legs.
It's exciting to see varicose vein patients, you know, who are in their 80s or 90s coming in versus my younger patients for cosmetic medicine. So it's a different degree of satisfaction being able to help someone with varicose veins. Veins can either be for cosmetic reasons or they can be due to symptoms.
And that was something I learned recently about all the symptoms. So won't you tell us about the symptoms?
Absolutely. So apart from the look of them, I think little is known about varicose veins and all the symptoms they can cause. So they can cause aching, heaviness, cramping, swollen legs, restless legs. You can also get patches of rashes, which is actually varicose eczema. You can get pigmentation changes. And the biggest thing we want to prevent is there is always a risk of varicose vein ulceration. So if veins have been present for a long time, it affects the condition of the skin, especially around the ankle area. And we do see patients who've had ulcers caused by veins for years and years. And actually, you know, they've been going to the district nurses for years and years, and it actually is a case of looking for the cause. Treat the varicose veins, give them a few months in stockings, we treat the ulcers. And that's so satisfying to bring that quality of life back to someone. So yeah, it's different parts of the body, different levels of medicine, wearing different hats, but that's what keeps my job exciting.
And you have a beautiful clinic here in Tauranga.
Thank you.
And so people can call in, they call on from all over New Zealand to see you.
They do. I still have my fans and followers from over 10 years ago, from when I started in Gisborne. I have people who come down from Auckland. So the veins, you know, we do once or twice a week. I do also fly out to Auckland for a clinic to do veins, so I contract my services up there. And the cosmetics, look, it's, I'm never pushy, I'm not a pushy injector. I have my own style, and I'm very black and white. So, different ways that I deal with patients that come for certain needs, and I guess the fact that we've grown so quickly in the last 18 months means hopefully I'm doing something right.
That's great. I presume most of your clients are women?
Majority of our cosmetic clients are women. Our average age is probably from mid-30s up to sort of 55, 60.
So it's better to maintain before everything
Absolutely.
heats up.
Absolutely. There's never, you know, I get asked the question, when is too early to start? Well, everyone's so individual, you know, but the saying in our industry is, the earlier you start, then it's maintenance rather than having to actually spend a whole load on repairing. So start maintaining early.
Dr. Anuya, it has been such a delight to chat to you today. Thank you so much for your time.
Thank you so much.
And thank you everybody for joining us. Please don't forget to subscribe to our channel and we'll see you next time.